Months ago today, our government released the primary and secondary educational guidelines so school divisions could begin developing their local plans for a safe return to school. Since that time, education and health officials at all levels have been working tirelessly to ensure learning spaces are safe for our students and staff returning to school. We've evaluated best practices and emerging research. We've reviewed local plans to ensure they adhere to our provincial guidelines and started preparations for September 1st, including the procurement of necessary hygiene, sanitation, and PPE supplies. As a result of this work, and with the support of our Chief Medical Health Officer here today, we're releasing the Safe Schools Plan. Our plan focuses on the safety of our children in 8 areas: safe attendance, safe transportation, safe access, safe facilities, safe classrooms, safe supports, safe activities, and safe alternatives. Our plan will provide safe spaces for our staff and students for the new school year. Unsafe attendance. If students or staff are ill, they should remain home to ensure safe attendance for all. However, if students or staff members present with symptoms, schools will ensure they are properly isolated from the rest of school until they're able to leave. Protocols include a dedicated quarantine area and the use of PPE in this instance. On safe transportation, we want to ensure students are coming to and from school safely. Where possible, we're continuing to encourage parents to transport their children to and from their schools. Recognizing that busing is still needed, specific protocols for seating are being implemented. Bus drivers may see things like plexiglass shields in their workspace, and cleaning and sanitation of buses are required between each run. On safe access, the daily flow of students and staff in and out of our schools will be safe. Divisions will be communicating local requirements around dedicated entrances, start times, and the movement of students and staff within the facilities itself directly to their school communities. On safe facilities, the cleanliness and sanitation of our buildings will ensure that we have safe facilities. Increased sanitation measures are in place. This includes the availability of hand sanitizers where possible and additional custodial supplies. In particular, schools will work to ensure the increased cleaning and sanitation of high-touch surfaces. Safe classrooms. The safe sharing of space in a classroom is a large focus of our plan. Proper hygiene practices have been established, as well as protocols for bringing supplementary school materials, such as backpacks and school supplies, in and out of schools. We know that maintaining physical distance is less practical, and the focus should be on minimizing physical contact instead. Classrooms will be configured to support this. On safe supports, we need to continue the support of learning of all our students. There are considerations of our intensive needs and immune-compromised students, as well as protocols in place to support the mental health of students and staff. School divisions will communicate regarding these supports directly with their local school communities. Safe activities. While we were planning for school to be as close to normal as possible, we know that group activities need special consideration. School assemblies will look different, as many schools are planning for virtual interaction for their larger school communities. For extracurriculars, we know that many students have already returned to sporting activities, and we look forward to those activities resuming safely within our schools. Safe alternatives. There are 4 scenarios that have been activated regionally or provincially, that may be, based on the advice of our Chief Medical Health Officer, and they include: Level 1, return to school as close to normal as possible with additional safety measures and precautions. This is the scenario we're planning for September the 1st. Level 2, should there be a need, we are prepared to recommend mask usage for staff and students based on the direction of our Chief Medical Health Officer. These masks are being purchased centrally by the Ministry of Education and distributed to school divisions. Level 3, in the event it becomes necessary, school divisions will reduce capacity within schools, which may include cohorts and hybrid learning models as consideration. And Level 4 is implementing learning continuity plans, which means transitioning to mandatory remote learning. Moving from one level to another would only be done on the advice of our Chief Medical Health Officer. but we know preparedness is paramount. That's why I'm sharing these additional contingency measures with you today. We also know that school divisions and health officers need to have regular communications as we move through the school year. So today I'm also announcing that we're establishing weekly briefs between the education sector and health officials to bolster our monitoring and access to local context and needs. This will allow both sectors to focus efforts and action, including things like testing and additional supports, or restrictions should that be required.